Hi, I'm Dr. Vincent Rowe, Program Director for the USC Vascular Surgery Training Program. And I'd just like to formally welcome you to our program. I'm so glad that you selected us to apply to for vascular training. And just understand there was a very competitive application class this year. So I know all of you are very well sought after by other programs, but hopefully after you visit our program and interview with us and hear about our program, as I'm about to tell you in the next 20 minutes, you'll strongly consider coming here because we believe we have a fantastic training program to make you a complete vascular surgeon. Let's go into some of the details. Our program started in 1999, and then we were approved for 2 years in 2003. We're currently an accredited 2-year program, and we also have an early specialization program. We started that in 2011 and have graduated 4 people so far with that training. What that is people that are in our general surgery program here at USC that decide they want to do vascular surgery during their final year of training. They transition over to vascular surgery and spend anywhere from 21 to 24 months in our training program. And then they graduate with um, being board eligible in general surgery and board eligible in vascular surgery. And then, of course, the 5 and 2 program, which you're applying to. And we started that in 2012 and have now to date had 3 graduates. This is our faculty. Dr. Weaver is our division chief and going strong. Dr. Katz is the program director at Huntington. There's myself as well as Dr. Ochoa, who's the associate program director. Dr. Lee is our venous specialist. We have Dr. Hahn and McGee that perform most of the complex aortic surgery. And Dr. Ziegler and our new recruit, Dr. Manzoor, who are partaking in all of the aspects of vascular surgery. And we've really beefed up our podiatry team with 3 podiatrists, Dr. Armstrong, Shin, and Dr. Khan. Some of the new developments, our aortic center, I'll go over some of the details of that shortly. We remain very closely integrated with cardiology. In fact, at the county hospital, you will perform angiograms, peripheral angiograms with our cardiologist, maybe 1 to 2 days a week. Our venous center is working well. Dr. Armstrong brought the Southwestern affiliate for limb salvage to our center now, and we will be renaming that after USC. And as we said, we're closely related with the podiatrists in their training program. One of the training sites, the county hospital, 600 beds with electronic records and a level 1 training center. And they do have an endo suite that we utilize at least 1 to twice a week. We perform EVARs, TVARs there, and you'll be all a part of that, as well as trauma cases. Here at Keck, we've had a real explosion in terms of our endovascular training, especially in the aortic space. This is our brand new revitalized endo suite. We had an endo suite for the past 15 years, but this has now been upgraded with 3D fusion and CT scan capability. It's an incredible unit, and you'll learn quite a lot from Dr. Hahn and McGee in this area. We have the aortic center, as I spoke about, and you can see back in 2012, we weren't getting very many aortic transfers. Now we're up close to 300 aortic transfers a year. These includes type A, type B dissections, as well as aneurysms. And so you will get your share of aortic surgery here at Keck. And the aortic surgery you'll do will be highly varied from EVARs, TVARs to fenestrated grafts, physician-modified grafts. And Dr. Hahn now with his IDE is able to do procedures like this and have the approval of the FDA. We're also involved in a lot of clinical trials, and currently we're the #1 enroller in the TAMBI trial, and our aortic trials for research just continue to grow and grow. So we'll be the ones here that will have the devices first, and you'll be a part of it. At Huntington, this is our 3rd hospital where you rotate, a level 2 trauma center, and also has a general surgery residency. What about the cases? The cases you can see These are our 205s that graduated 2 years ago. And what I'm most proud of are the aorta bifems. It's quoted that 25% of graduates don't do at all an aorta bifem. And here our trainees are doing more than 10. And Eric and Neil had 9 that year, as well as a whole variation of all other cases. So these two graduated at the same year. So that year there were 20 aorta bifems between them, which I think will set you up nicely for your training, for your practice in future. These are the rotations that you'll have. You'll do vascular surgery the first 3 years. I believe this is now expanded to 4 months, and this is now expanded to 3 months. So you'll be a part of our team throughout the whole year, and we do our conferences virtually, so you'll be able to log into the conferences all the time from whatever service you're on. And then later, your years will basically rotate between Keck and Huntington and County, and those will be the rotations. It varies between either 2 or 3 months rotations, depending on how many chiefs we have. Our educational conference is very robust, from Morbidity and Mortality, Journal Club, Research Conference, and so forth. And this is just an example of the schedule for the weekly. We usually have conferences on Thursdays, and the Thursday morning will be packed with either M&M, then pre-op conference, and vascular innovatives lecture. Every week we do have pre-op conference where we discuss the upcoming cases for the week at all 3 centers, and then we're able to discuss them. The fellows are involved, they present them, and it really helps to prepare you for what you'll see on your oral boards and what you'll discuss when you're in practice. Vascular imaging is part of the rotations with the new enhanced endo suite. You will become comfortable in performing all types of modifications to the CT scans to get the accurate measurements for endograft placements. And you will also become competent in the vascular lab, because you do have to have that to get your boards. Dr. McGee runs our research component, and we have at least monthly research meetings. We expect you to perform some type of research, because you will have a dedicated research year in between your 3rd and 4th year of training. At that time, we really look forward to you enhancing your training in any way that you can possible, either through clinical research or through some advanced type of research. This is what has been done in the research year. Elizabeth Miranda, she actually decided to go do the Paul Farmer Fellowship in Global Surgery. She spent 2 years out of USC in Rwanda. She had to come back recently for COVID, but she's been closely involved because she sees herself as doing that when she's finished, having a real global presence, and she's putting that presence there for vascular surgery. Anon, our current 3rd year, he applied to biodesign fellowships, and he has obtained the fellowship at Stanford. And so during his research year, he'll spend a year at Stanford in biodesign. He's also very interested in customizing endografts. So this will definitely help him for his future. So this research year, not just a year to stay buried under charts. You can if you want to, but if you see yourself growing out in another area, just let me know and we will fully support you, as you can see we've done for these 2 applicants. We have a skills lab. Everybody has this dry lab stuff, and yeah, it's not very exciting. But what we're truly proud of is our Cadaver Lab. We had to stop it briefly for COVID, but we're back running. We have an unlimited supply of cadavers through a foundation that continually donates them. And we practice exposures, cryoveins, and to me, the most interesting thing of all is the active perfusion. We're able to perfuse the cadavers, make this very lifelike in terms of surgery, and then test you and see how well you can do on it. Here's an idea. This is a perfused leg. You can see that it's simulating a gunshot wound to the distal thigh. The resident has to get in there. We're not scrubbed. The attendings are not scrubbed. This is all the residents. This was one of our 3rd year residents. So he was there getting out proximal control. You can see the bleeding that's happening. If he doesn't get control, it's actively perfused. You can actually kill the patient if you don't know what you're doing. It's all simulated, but it can happen. Okay, so once he gets vascular control, you can see that now the bleeding from the gunshot wound is decreased. He finishes the dissection and then is able to sew in a nice graft to repair the artery. There's nothing more like life than you can have except with this model. It's incredible. It's a great teaching tool for you. And I think it's just remarkable in how it puts you to the test without the attending in a very lifelike situation. These are our residents in the 05 program. Josefina was our first graduate in 2017. She's joined private practice. Eric has followed, and he actually has moved from here and joined Josefina up in Sacramento. Neil Reddy is in private practice in Palm Springs. Lewis is going to be graduating this year. I believe he's going into private practice in Spokane, Washington. And the next ones up will be Lisa Miranda, Alyssa, and so forth. Who fills up here is up to you. Hopefully you'll all want to be here at USC. I think we have a great program. Talk with the residents, talk with the faculty, and if there's any other questions, just ask me, I'll tell you. But again, we're just excited to meet you, and hopefully you are just as excited about our program. Thank you.